unhealthy choices.
Obviously
So
not.
let's talk a little bit about what would be the healthier choices to make, like if you're trying to, prevent, manage, reverse diabetes. Let's get into a little bit of basics of how and what to
So let me explain. So the insulin resistance, like we talked about, is the low sugary, low concentrated carbs. And so how to reduce it is by avoiding those things and the whole grain foods and omega-3 fatty acids and all those things. But the normal day-to-day foods, which really is an eye-opener for people to realize that what actually causing diabetes. Let's go through one by one. And of course, red meat also has been linked with diabetes, almost 19% rise. Milk has lactose. Lactose is all sugar. If the 40% of the calories of the cow's milk, whole cow's milk, is lactose, and lactose breaks down into glucose and galactose, and it actually there is a positive link between milk and diabetes, which not many people know.
Right.
But sometimes people say skim milk is healthier than whole milk. What would you say on that?
Well, I think we were talking the other day, you brought up a good point that, okay, supposing it's the whole milk's calories, 40% is lactose. When we turn it into skim milk, all we're doing is removing the fat, right? So its calories go down, but the lactose still stays the same. So I don't have exact numbers, statistical numbers, but you can imagine it will be a lot more than 40%. So you think that skim milk is healthier by reducing your fat intake and help good for your weight and all that, but you may be hurting your diabetes. So in either way, milk is not good, period, So obvious foods that we all know can cause diabetes, sugary foods, yes. But then a lot of cereals. America runs on cereals. There are tons and tons of cereals, but are they healthy? Ask yourself. Or you would rather have oatmeal bowl suggested by Kalindi. You can see the difference. Most of the cereals are loaded with sugars and carbs, simple carbs, and that's what causes diabetes. One bagel, I see every day I pass by a bagel shop, I see a long line waiting to get in. So they cannot even make enough bagels. One bagel, 400 calories, 17 teaspoonful of sugar. One bowl of pasta, 12 teaspoonful of sugar. Hidden sugars, roti. One roti is 6.5 teaspoonful of sugar. And who eats one roti? Right? One bhakri, which is 2 rotis, is 13 teaspoon. 1 cup of rice, 18 teaspoonful of sugar. And the worst of all is 1 cup of corn, 60 teaspoonful of sugar. They make corn syrup out of it. In fact, the Southern American population in the South America, they have a lot of cavities, and they
regular level, which
that's because they have a high fiber content, and fiber doesn't get absorbed.
Exactly.
So first of all, your sugar is kind of diluted versus concentrated, but also the fiber kind of slows down the process. And because whenever there is a sudden spike of sugar, it causes a tremendous strain on your pancreas, which is really called upon to make more insulin, but it's really cannot. So by repetitive attacks, you actually destroying your pancreas versus eating the whole food plant-based diet, you saving your pancreatic life, so.
Yes. So,
I think fiber here is a wonderful thing that is very underrated, I would say. We are talking only in terms of cholesterol and diabetes, but fiber has benefits much beyond that, even in colon cancer, Dr. Shah, right? The other day we were talking about the studies.
Right. Correct.
Fiber is really, it's very underrated.
It's underrated, and most of the population does not get enough fiber. And if that is one food we are supposed to keep in our mind is think about fiber. It actually reduces your risk of so many diseases and conditions, because there is a wonderful mechanism that fiber inside your body regulates. Dr. Shah, do you have this?
I have a slide. If you log off, I can join and share the screen, and then I can show you.
Right.
It's a very self-explanatory slide, but it needs some explanation. So the fiber, they're rough in texture, right? So what they do is when they slide through your intestine in your stomach and then your small intestine and all that, they actually do a scrubbing function in your inner lining of your intestine, which is a very soft and delicate lining as it is, but it is lined by the billions and billions of cells. So what fiber does, it does the scrubbing function, removes the dying cells. I mean, this is a normal process. Our cells die all the time and we make new cells, which is a normal process. But fiber kind of speeds up that process, removes the kind of dying cells, and dying cells also towards the end of their life, they produce or they actually harbor the oncogenes. Oncogenes are the genes which are more responsible for causing cancer. So fiber, one thing it does, it removes these cells, removes the dying cells, removes these oncogenes along with it, and more healthier cells come in the front, which has a more capacity to fight the cancer. So number one job that fiber does, it reduces your incidence of cancer, of course, but it also gives you a full bowel movement, so you don't have constipation and things like that. But also, like we talked earlier, that by diluting your carbohydrate, they slow down the absorption of your sugar. So that's also definitely a great thing. And one more thing, my favorite thing, is that by doing the scrubbing function, they remove a lot of inner cells, and then they work like a sponge. They hold on to these cells. Like I said, the cells normally fall anyway, but they go into the large intestine. And cholesterol, don't forget, every cell wall has a cholesterol, and body does not want the cholesterol to go into the stool. So it actually reabsorbs the cholesterol. See how smart body is. And we don't trust our body, but we trust the scientific studies rather than our body. So this body is so smart to reabsorb this cholesterol, but fiber doesn't let it do. It holds on to these cells. So that's why, as you said, the Quaker Oats puts it in its box that we reduce cholesterol by 15%. They used to put down 15%. The percentages are taken off. But the reality is that high fiber diet will reduce your cholesterol, will reduce your sugar, will reduce, and a lot of other things. Like I said, it also gives you something called great microbiomes. Microbiomes is the gut flora. Very healthy bacteria are flourishing when the lot of fiber is given. And don't forget the weight loss, because fiber kind of occupies a lot of space in your stomach, makes you think that you got everything, but calorie wise, it doesn't give you much.
So Dr. Shah, I'm gonna briefly share this slide about, and you can even talk about, something like this.
Sure.
Let me see. Are you able to see this? Am I sharing it? Okay.
Not yet.
Okay, let's see. So here it is. Let's start. This is an excellent way. This is a really excellent way to understand the importance of, filling yourself with foods that have high in fiber.
Yeah.
Look at, this is just a representation of our stomach. Sure. So you can fill yourself up with oil, like 2 tablespoons oil. You can, when you have, 2 tablespoons of oil in salad dressing or any other way, look at how much space it occupies in stomach. It's still empty, right? You can have 400 calories worth of cheese. Still it's not filling, but versus compare it to fruits, vegetables, or whole food plant-based. You are full, right? The stomach is full. There's no more room.
No brainer.
There is no brainer. So when you think about whole food plant-based, maybe you're thinking about vegetables and fruits may not fill me up, maybe just grains, they may not fill, but it is filling. And the filling, your stomach feels satiated, right? So, including more whole food plant-based diet, more whole food plant-based in your diet, helps you lower your blood sugar, lowering cholesterol, reducing your risk for heart disease, type 2 diabetes, and on top of it, giving you so much benefit over, any standard other diets.
And let's not forget about the cancer part.